How's it going, everyone? Welcome back to another episode of the Diabetes Survival Guide Show. Today, I am joined by someone you can call a influencer on Instagram who posts the most amazing content and relatable content, specifically for people who are physical therapy students or physical therapists that are out there that struggle with mental health concerns and make jokes out of it. Because as we all know, for plenty of people who are out there who are struggling with anxiety or depression, they tend to go online and sometimes they make jokes out of their situations, which is horrendous. However, if we're able to get a few giggles along the way and still survive in that aspect, then why not? So she's developed an amazing community to support people and knowing that they're not alone in how they feel and just be a resource for them. Additionally, Kay is a pelvic floor physical therapist who has helped people who have experienced sexual assault, and she's very helpful in allowing them to heal from that journey and recovering from the trauma in that process that has occurred. And Kay has also experienced a traumatic brain injury in the past and is able to explain the differences between experiencing that and the support that goes along with it, or lack thereof, unfortunately. Spoiler alert. And those who might get like a physical impairment, like if they sprain their ankle or something, and the resources that they would get from that. So it's drastically different, and I'm not going to spoil too much about it, but without further ado, Kay, please uh, tell us about yourself. Tell us about your experience with managing your TBI and anything that I haven't covered yet.
Yeah, it's hard to introduce myself after such a solid introduction like that. So thank you, Patrick.
I do my best. I do my best.
But like Patrick said, my name is Dr. Kay Mastrocola. I'm a pelvic floor physical therapist and the three brain cells in a trench coat behind the online page DPTs with Anxiety. And a lot of my work in pelvic health revolves, like Patrick said, against trauma-informed care. So everything that I'm doing does come from that lens with more of that holistic body and mind. When I'm not a physical therapist and when I'm not using humor as medicine to help, I am diving into whatever next ADHD crafty fixation I can get my hands on. So if you are watching the live video and see like my whole like myriad of sticker jumbles behind me, that's how you can find me in my free time. But yeah, I'm excited to be here. And
Yeah.
so you had asked about my TBI.
Mhm.
And so I am in a interabled relationship. So I have ADHD and my partner has autism. And the reason I mention that is because on our third date, we decided to go rock climbing. And that is where I also learned that he is very competitive. So we decided to race up the bouldering wall, which for all of you guys who don't know, that's a wall that typically you're supposed to climb like laterally, slowly. We obviously were not rock climbers and we're just, two impulsive 18-year-olds. I went all the way to the top. I was about to win, and I went to go hit the top peg to stop the timer, and my other hand was on an unstable peg, and I actually lost my grip and fell backwards 16 feet onto the back of my head. And so this is in my first semester of undergraduate degree. I went to a 6-year direct access program, so everything was streamlined for PT school. And I suffered, thankfully, only a severe concussion that typically would take someone 3 to 4 weeks to recover from. And when I had brought these concerns to my university and asking, like, hey, this is what's going on, this is what I'm struggling with, I was faced and given the ultimatum of, we'll just pause your academic semester. You can go home and come back in a year. But also, you're too far in the semester to where you won't get a financial refund. And I
Ugh.
was like, what? And when given those in quotes accommodations, my other option was, well, you can take a week and then see how you feel and then come back and continue. So anybody listening, and as evidenced by only getting a concussion, I do have a very hard head, both literally and figuratively. So after like a week, I was like, you know what? No, it's fine. I'm fine. And I pushed that recovery process to where now, unfortunately, I do have post-concussive syndromes, vestibular issues, and I can't read lined paper. And it also worsened my anxiety, my depression, and what I know now is my ADHD. And so those accommodations, as Patrick was alluding to, were not, when we see this a lot in the realm of both invisible illness and in mental illness, is that, and especially with physical therapists, we have this like paternalism aspect to us, this godsend of I can heal the sick and the disabled. And it's maybe we can just teach them how to live with their disabilities. And so it's a different mindset of let me care for the little birdie versus let me empower you to fly out of the nest. And so I wasn't really given that option. And when we look at invisible illnesses, I feel like when PTs especially see these things, it's hard for us to visualize how to fix it because there's not a cane, because there's not a crutch, because there's not, an antalgic gait pattern. So we're not looking beyond the surface enough to know how to help, nor do people care sometimes, which just sucks.
Hmm. Oh, that timeline of uh saying, "Hey, let's go on a date. Let's try something new that we've never ever done before," and having very competitive spirits go head to against each other to then experiencing the unfortunate injury and all the symptoms that goes along with it, to then being put in the hard place of, all right, you can do a year break, but you're not going to get your money back, or you could still persisting through. It's you're not really going to given that option to have that middle line to how can we receive the accommodations so that I can be supported to still survive and keep going and be successful at that, to now experiencing long-term consequences of like trying to read line paper, which sucks because a lot of things that are out there, especially for some signs, they're on lined streams. Oh my gosh, that is crazy.
Yeah, yeah. And it's challenging because what I know now is that there actually were accommodations that could have been provided to me. I could have been able to get an incomplete and take that extra time, but it wasn't offered to me because it's a lot of work. I
Mhm.
had to do the research and digging myself to find that. And with a concussion, I wasn't reading. And
Mhm.
they were providing me with the choices that they wanted me to pick, which for even in any scope of healthcare, I feel like that it's manipulative, but not always for the positive. And so we can see that across every community, there's always those fine lines there.
It's like the option of, hey, we've been doing this for so long, let's keep doing this rather than here's this other routes that we can actually help other people when they need it, who are this is specifically made for, to then just ignoring it entirely to try and force people to fit in this mold in this box, which is it just aggravates me in my opinion.
And that's why I think my page has taken off in such a weird way that I could never imagine or conspire it to be, is because I very much live under that mantra of what happened to me, why the heck would I want it to happen to you? And so I start talking about all of these different accommodations that people could not even think of because when you're so deep in the water, your only mind is on survival. And you
Mhm.
have to go back to those comforts of how you did learn, how you did study, and how you were taught to, that you don't have that extra brain space in order to take on something new. So when you have someone, even if it's a stranger on the internet, gifting you this like alternative viewpoint, it can feel almost a godsend or something like that, which I never claim to say that I am. I'm just out here sharing my own silly experiences in life.
Yep, exactly. And I love it. Um, for the people who are listening to this, watching this, and tuning into this and uh, wanting to understand and feel the messages that is being talked about, they're like, how does this have to do with diabetes? Like, this
Mhm.
is completely separate. Why are we talking about these things? I will say, how often can someone have a slip and a fall and they hit their head and might experience a traumatic brain injury? It's very common. And there's a lot of times where it's a, all right, I have this one thing, but then they ignore all these other things until it happens. Now it's say, I have this thing and I have this thing, and it just compounds everything else altogether. That I'm looking out for the people with diabetes who might be experiencing a traumatic brain injury because it's unfortunately it's relatively common that can occur. And this is why it's important for us to learn more about these experiences because the demands of someone with diabetes, generally, whenever they go to the hospital, they're talking with their healthcare provider, similar to what Kay said, the doctor would present them with the option of, hey, eliminate your carbs or take this medication. That's the ultimatum, rather than what about learning about nutritional sciences by talking with a diabetes educator? What about going to a physical therapist or a personal trainer to learn how one's blood sugars can be affected with exercise? It's like they weren't given that option in that 10 to 15-minute time span window. Instead, they're just giving the cookie cutter response of, here's this, deal with it, and we'll see you later. And sometimes that see you later is discussing an option for a potential amputation surgery, or hey, you needed to start talking to your eye doctors because someone's
Mm.
developing cataracts or glaucomas. And I don't wish that upon anyone. I wish everyone a safe and healthy journey. But unfortunately, that's just how the healthcare system is made, where there's already a prefabricated, here's this, take this is the easier option. This is the option that's also going to probably bring more profit to that person. And there's that disconnect that's going on rather than let's understand what your goals are. What do you want? And how can we create a personalized resource plan that you can utilize so that you can quote unquote leave the nest on your own and grow in your own way.
Well, and that's something I talk about too, especially like in my treatments as a physical therapist, where I feel like I have a lot of people call me like a revolutionary PT. Like they've never had a PT like me before, which always feels nice, especially since I've only been doing this for 2 years. But it's really so I work like primarily with the prenatal postpartum population as well as my trauma survivors. And my big philosophy in physical therapy is I am not going to give you a 30-minute home exercise program with movements that you're just going to repeat, because then all you're doing is learning the movements. I would rather spend our hour in here teaching you how to move. So that way, when you go to your fitness classes, when you lift your kid, when you go back to those things that bring you joyful movement, you can start to piece together, oh, that's how I turn on my TA like I did when doing a bridge, when in reality, you were actually getting up off of the floor. So that transition through education is really where we should be moving as physical therapists and in our diabetes education. And there's so much overlap in the actual education part of both of these kind of chapters together.
Mm-hmm. It all melts together. And the quote that my dad says, because before, for those who haven't known this, I've been working in my family restaurant since I was 5 years old, Chinese restaurant. And I was always sick and tired of working in there, dealing with rude customers, and trying to practice a sales pitch to someone who may not want to eat Chinese food at that day. Because if someone wants Italian food that night, you can't really sell them on having Chinese food at that night. So for me, it's trying to figure out all the intricacies of the adult world while being a 5 year old, just trying to learn how to do basic and simple math just because we can make meets ends in our low income situation. And as I kept on growing up, I kept on telling my parents, like, I can't wait till I move out of here and I can't wait to do my own thing. But this quote that always stuck with me with that I always rolled my eyes at when I was younger is my dad's everything you're doing here also interconnects with what you want to do in the future. And it
Mm.
wasn't until I got into school and going through physical therapy school and working with other people that I realized he was exactly right. Whatever I'm doing now, it also translates to the other aspects of my life. Similar to someone with like diabetes. I presume that someone with diabetes, they're not just someone with diabetes. They're going to be someone who is a husband, a father, a mother, a daughter. They're going to be a cousin, a niece, a nephew, or
Athlete.
yeah, an athlete. It could be someone who loves doing art, is artistic, can be this whole slew of this bouquet of like different personality traits and different identities that makes up this one bundle of who they are as a person. That's like diabetes is just one small segment of that, and there's everything else that all intercalates with it to make that person. And that's what we're trying to move forward to figure out how can we just educate you on this process so that you can move forward in not only managing this one part of that person, but also how can it correlate with the other parts of that person that it influences? Because we might all have the same hours in the day, but we're all living in it in a different way. And how we perceive it is all being perceived in a different way too.
And that's what's challenging sometimes with my trauma survivors is that there is a very fine line between, and I'll use disability instead of trauma, but there is a difference between identifying as having a disability and making your disability your identity.
Hmm.
And it is so valid that those lived experiences can become all consuming. And I am not taking that away from you. But until we remove yourself from being plucked by the thorns every single day, so you can start to see that bouquet a little bit more of everything else you are, that's when the healing starts to begin. You have to do it for the right reasons. And one of the hardest things I learned in my journey, both growing up with a medically complex parent and in working in these trauma informed spaces, is that you can do everything right, and it's okay if the person is not ready to receive your care.
Mm-hmm.
They may come in with the intent and stay in that contemplation and intention phase that entire time. And you just need to continue to be optimistic for them and keep the door open. So then when they're ready to come around, that's on them. You can try to convince someone who wants Italian to have Chinese. It might not fill that niche that they need that day, but give it till Wednesday.
Yeah, exactly. All right. So I know everyone's starting to get excited. Wow, Kate's amazing, and I want to know more about her. So, what inspired you to become a pelvic floor physical therapist?
Yeah, like I alluded to before, I had a medically complex parent. So my dad had spina bifida. So when he was born, base of the spinal cord was born open, left him with no bowel or bladder function or control and low motor control. So his calf muscles were really weak. So short distance walking, things like that. So physical therapy was never something that was uncommon, unfamiliar to me. It was always bits and pieces in our lives. He would go get a little bit stronger, come home, and then go get a little bit stronger, come home. And then it wasn't like the conversations of bowel and bladder dysfunction were never weird to me. Sometimes you would just have to clean up after messes that happened and help in ways and just stay neutral to that. That's part of life. And then as I got older, just the idea of like human sexuality and self-expression in that way and the LGBTQ community, those kinds of communities that deserve representation and care really became like a pocket of passion for me. I had my own kind of gynecological issues as well. And the way that I was treated was not in the way that I would treat somebody. And so I was like, okay, do I do PT because of my dad or do I do gynecology for me? And PT just felt more accessible at the time, both financially and just knowing my brain and what it took to become a doctor. So then I went that route. And then when I found out that pelvic floor PT was a thing, I was like, this is the perfect marriage of everything I could want in my life. And I dove headfirst. I haven't done anything like else since. And about 98% of my caseload is pelvic health, which is such an orthopedic base. I don't lose my orthopedic knowledge, but maybe I'm just not doing an empty can test every day.
Yeah, everything's all together.
Exactly.
Yeah. And from there, of course, being there for your dad and knowing what that's, and then also learning more about, hey, how can I try and meld the two worlds of like gynecology and like melding the world in physical therapy together, and pelvic floor physical therapy was discovered, and now you're here. And I'm sure other people are wanting to know more about the timeline of now, how did your interest uh, then shift to working with women who've had experienced sexual abuse or trauma? Because that's like really hard to hear about for like even physical therapists that are out there. Because I don't know many folks who are wanting to like work with that sensitive population per se.
Yeah. And I have been in therapy since I was 18 years old and have just taken and grown so much from my own healing journey of different factors of my CPTSD, rejection sensitivity dysphoria, just ADHD in general, these kinds of aspects of me that I was starting to recognize patterns in my patients of things that I was seeing in myself retrospectively. That's the word. And it was then that I realized that I am in such a privileged position to be able to spend an hour with a patient where other doctors may only get 15 minutes. So if 30 minutes of that session is neuro down training and diaphragmatic breathing and somatic tracking, right? Because you cannot separate the brain from the body. So if you are having such dramatic fight or flight signals happening all over the body, I can do whatever manual technique, whatever stretch I want to do to that pelvic floor. But the second that fight or flight comes back on, all of our work is for nothing. So if I'm not treating it at the source, I'm wasting your time. And so I just found that, especially living through trauma and growing up in those different spectrums, which I'm not the most comfortable going into on here, and I'm not going to. But with some of those things, I've healed from it enough to where it's like I'm jaded to it a little bit, to where it makes it more comfortable for me to give that perspective to other people safely, which has been really helpful because it's like it's more of that empathy versus sympathy. But it's also, I don't take the weight of it because I know that I can't. It's just, I can only do enough, and that's enough.
Oh, that's awesome. Being able to figure out, okay, how can we navigate these complexities and figuring out what can I do to support them and know that what I provide is enough without going above and beyond, without going below the barrier, but just meeting it right at that threshold where it's comfortable and slightly uncomfortable to go towards growth, but just enough where it's not too much and it's not too little.
And let me tell you, the best way that you can do that with your patients, even if you're not trauma informed care, is look them in the eye and say, yes, that does suck.
Mm-hmm.
Validate their feelings. Again, throw away the paternalism model of you're there to save them. They're not coming to you to be saved because they know. Don't remind them that they are broken.
Mm-hmm.
Acknowledge that the situation they're in sucks and advocate for them and encourage them to continue their healing. And that's something anybody can do, training or not.
Yep. Mm-hmm. Oh, love it. All right. So with that being said, for those who are like, all right, this is all crazy. I know I have diabetes and I want to try and improve it.
Mhm.
So I'm sure they want to know, okay, what experience do you have working with people with diabetes and what have you learned from those experiences?
Yeah. So, from a personal standpoint, my dad, because he did have the lack of mobility, did end up developing type 2 diabetes, which led to really hard and tough, like diabetic ulcers that I had to care for. So, if y'all need an Una boot, I got you. And that kind of conversation and awareness and just recognition of the barriers to care that come with diabetes as a practitioner now makes me more aware of better ways to communicate with my patients. I can't just give you two options because I don't know if that's going to work for you. So that's the first. And two, in my actual like clinical bubble, I work a lot with people who come in with gestational diabetes and they are absolutely distraught. I did everything right. I did that. I cannot believe that this is happening. And they have a right to panic because media is not kind to the connotation of diabetes. It is typically a fat person's disease. And if you're not watching the live stream, I put that in such severe air quotes that it could be like bolded 70 times because it's not correlated that way, but it's the way in which fear mongering gets clicks and likes and companies get money. And so it's having, again, those conversations of it's not your fault. These things are out of your control. You could do everything right. It's just the demands on your body are so increased right now that your pancreas does not have the resources for it. There was nothing you can do to prevent this, but let's now work with what we have.
Hmm, powerful. It reminds me of the the terms of, hey, with your dad having spina bifida and diabetes. As we can tell, there's a correlation there, like a condition with another condition. Like it's this huge spectrum that we gotta figure out how can we treat the person as a whole by providing their options, educating them, and moving forward with it. Instead of giving two options for this without recognizing the other situations that people have. Because my thought process is if someone comes in and they are wheelchair bound and they don't have the ability to walk, my suggestions of, hey, you just need to walk after going, like after eating your meals, like that's not feasible for that person. It's just figuring out how can we tailor it towards that person and then trying to learn what their situations and their backgrounds are. So then we could come to a situation to figure out how they can best be educated to take care of themselves. And then
And
also,
teaching people how to advocate for themselves in doctors' offices whose doctors are giving them ignorant suggestions.
mhm.
Because a doctor's visit is technically a transaction and you should be getting something for your money, right? And something that I remember just so vividly is I was like 19, 20 years old, came home from college, taking my dad to the wound clinic and open wounds, no bowel or bladder control. And the doctor's, you should try swimming if you can't walk. Just walk in the water. And I was like, sir, one, no, two, where are we getting a pool? Are you going to buy it with your doctor money? Because I would, and there's, we'll go to the YMCA. And it's, oh, are they going to, if there is like a bowel explosion, like what kind of things are you suggesting for that? And there, again, not a even consideration for PT or nutritional counseling or anything like that. It's so bizarre.
And not to mention too, I had the fortunate opportunity to volunteer for the uh, Orthotics and Prosthetics Athletics Foundation. And one of them was going to a pool, and not all pools actually have the machines to help someone who can't physically use the steps to get into the pool in
Mm-hmm.
there. So it's like being a provider who just says those blanket recommendations, like even if that person does show up to the pool, what's going to happen next if there aren't the resources to help them get into the pool safely and be able to enjoy the access to that? Like it's very disjointed with that. And plus, what if that person doesn't even know how to swim? Like, what's going to happen there?
I get it. I hear you.
Oh my gosh. And then also like working with the woman with gestational diabetes. For those who haven't checked out the podcast last week with Kylie Austin, where she debunked that someone with diabetes uh, is like a fat person's disease. And I say that in huge air quotes because the media is misinformed about it. That even someone who is doing all the right things, where they are exercising well, they have a good BMI, they are uh, like eating enough fiber and all those things, that maybe that's just not enough. And genetics are playing such a factor that they have so much insulin resistance. So their muscles, their brain, the organs in their body isn't responding to the insulin well enough to actually allow the blood sugars to get into the body to be used off as fuel, that it just stays left behind in the blood. That sometimes you could be doing all the right things and the outcome that comes about it isn't controllable. So it's never anyone's fault whenever they develop a diagnosis or a disease or any situation that happens because of that. Because generally, there's always something that we cannot control that has a butterfly effect or a snowball effect that eventually leads up to that.
And who I see a lot with that in my practice is my PCOS girlies. So polycystic ovarian syndrome is a disease in which, again, like it would be nice if science studied women. We don't have enough information there yet. But what we do know is that there is an increased correlation between PCOS and insulin resistance and the increased likelihood of developing prediabetes and things like that. So much from more of that like holistic Eastern guidelines should be considered and start given to people.
And not to mention, when more women are being researched in studies, also making sure that it's not sexist in that generalized things too, and having that bias in there. Because I was working with a client recently, and she was saying that she was struggling with her menstrual cramps. And the doctor's recommendation for her is you just need to get a boyfriend, you just need to get pregnant, or you just need to like focus on doing these other things. That just completely disregards the person in general because they were just happy with where they are and they know their body, they know what's going on. She
Also, what if
also
she's gay?
yeah, exactly. She has fibromyalgia as well, so she just knows that whatever she has with the menstrual cramps, that it's amplified, and that's her normal, which is unfortunate, but she just knows that I just need to deal with this and move on with my life.
But pelvic PT can help.
Exactly. And she didn't know about pelvic floor PT until I told her about it and gave her some
Mm-hmm.
resources for it. So she's like, "Yeah, I've never heard about that before." I'm just like, "Ah, come on. What's going on here?" Oh, my goodness.
Mm-hmm. Mm-hmm.
So if that is the type of doctors who's running research studies and already has that biased approach for it, I'm horrified to see what results they would publish with that mindset right there, which is very unfortunate in my opinion.
Yeah, and just to cap this part of the conversation, just because it's like one of my favorite fun facts, is that we had 10 Bon Jovi concerts before we had a map of the clitoris. And I don't know if it's like the Jersey in me, but I think I want like the rest of my life mapped out in Bon Jovi concerts. But it just goes to show like how seriously recent female like the science of women has. So next question, Patrick.
Oh yes.
Could talk for hours.
Always, always. All right, so Kate, what has been your best success story with a client?
Oh, it's hard because success is so variable, right? And I think that's what actually like my podcast, like the Thrive Guide is all about. It's cool you're successful, but what is success? I would say in my own idea of, oh my God, I did something I didn't think I could do, is that when I was first starting out, I had a patient with like grade 3 cystocele bladder prolapse, some rectal prolapse symptoms, some stuff that was just like really wonky. Coordination was horrible, not the person's fault, and just all of these piled on confounding factors. And I had her walking out on her last day without a pessary, without anything, minimal symptoms, and a stronger pelvic floor. And it was those things where I was like, if I can fix that pelvic floor, I could fix any. So, from a practitioner standpoint, I would say that's where I felt most successful in my treatment skills and understanding and knowledge. But I think in any patient who walks out of my clinic feeling more empowered than when they walked in, I was successful.
Mhm. So being able to identify, hey, working with these cases that come in that are medically complex, that would make people scratch their heads and I don't even know how to work with this. And
Hmm.
then being able to empower them to be able to start addressing that and being able to manage the symptoms that they do have and being on that road of recovery and wellness. And also being able to like let everyone know that if they're able to take a piece of it where they can have one more aspect of their life that's just a little bit better and having that snowball effect of things starting to get better everywhere else. Because let me just say, if I were to compare like problems based off of what like the limbs that we have for people who are able to utilize their limbs, like if someone doesn't have the ability to use one hand at all and trying to do everything within their life. And it's troublesome, like it's difficult to then being able to, all right, we resolved the issue of the hand. Now I have my arm back that I can utilize. Like, oh my gosh, my world is so much more easier because I have one more hand that's available to me. And it can be just a simple thing to someone, but it makes a world of a difference because now their world has just expanded more in their access and ability to do stuff. So it's
And we
good.
got to celebrate those small wins. We don't celebrate, we're always chasing this big success, especially as PTs in higher academia, where it's always grind, grind for the degree. And then it's now what? Stopping to celebrate those small wins has been something that I've been working very hard on in therapy.
Oh my goodness. It's like the smallest wins too. It reminds me of that of the quote where it's like, all right, this is one small step for man, but a big step
Mm.
for mankind. And it's a similar thing for the clients that I work with as well, who's maybe it's someone who's struggling with their blood sugars and they've been at 200 consistently after eating their meals. They check it 2 hours later. And we tried one small thing of, all right, what if you tried going on a like I know that 15 minutes is too much right now for a walk, but what if we just tried like 1 minute of something? Let's see how that
Hmm.
goes. So instead of it being consistently at 200, it dropped down to consistently being 190 2 hours after meals. So it's and then that person was just in tears thinking like, oh my gosh, I didn't think I could do this. Who knew that just doing 1 minute of just standing up, sitting back down, and then moving around in the house had such a significant impact in being able to be below the 200s now. And then that was just a huge win for them. And then for some people, when they post that win on some Facebook groups or some support groups, I know there are plenty of people who want to try and take that away from them. But I'm like, ignore all those haters that are out there because you did something that
They're just
only you
boosting the
could do.
algorithm.
Yeah, exactly. It's like only you did something that only you can do. So take that as that win and just know this is you're just starting the successful journey that you do have. And there will be some more bumps in the road, but just know that the habits that you're creating, that is going to be enough.
Totally. Love it.
All right. So now, what would you say has been the hardest lesson that you've learned since starting your journey? And what did you learn from it?
Yeah, so I touched on this a little bit earlier. The hardest thing I learned, and as much as having a medically complex parent was tough, learning that people can't accept your health until they're ready to. Because when I went to PT school, I'm like, I had that model of I'm going to fix my dad, I'm going to do all these things, keep him with me. And he just wasn't ready for it. And that's okay. And it stung and it hurt so bad. And I felt like such a failure. I took it on as a personal loss. Um, but it wasn't. And I'm happy that I almost had that experience growing up really young at 16, 17, and then in my early 20s. Because now, as like an early professional, I don't take that home with me. I'm able to shelf it. So it does make that a little bit easier. So,
Mhm. That's awesome. Where it's like a person who's played such a significant role in your life, like being your dad and wanting to be able to help him, support him, and going through that process to then learning, oh, that's not what he's looking for. That's not what he's interested in right now. And
mhm.
just letting that know is this could be a not right now, but maybe down the road, it could open the doors. But whatever decisions that are made, just respecting it and letting like yourself know that this doesn't define me for all the no's that are out there. It definitely doesn't define me. Instead, those are just opportunities for me to leave the door open whenever they're ready and then work with those who are ready to go down that route to get the help that they want.
Absolutely.
Mm.
Absolutely.
Ah, so good. All right. So if you were to give one piece of advice to yourself during your hardest moment, what would that be?
So this is something I say a lot, and it was given to me by my neighbor who's like my second dad when I was in literally the low. If you were to ask him what was your lowest point, this is when this advice came. And it was, you can be the entire package and sent to the wrong address.
Hmm.
And I would get that tattooed on my forehead because there are so many times in my life where I have been told I am too much, I am too loud, I am too boisterous, I am too kooky, distracted, whatever. If I'm too much, go find less, as Elise Meyer says. I think that stands alone.
Yep.
No explanation.
Yeah, I totally get that as well because I'm just always finding myself in some situations where people are like, you can't do this. You shouldn't be doing this. What's going on here? Like, you're a bit much. Or, oh, why aren't you as like expressive as you usually are? Because
Mm,
maybe they're just catching me at a bad moment where I drained all my social battery. Like, contrary to what people think, I am an extroverted introvert. So
mm.
I'm an introvert by nature. And for those who see me, they're like, you're so energetic. You stand on tables, you cheer for everyone. You're just like the best cheerleader ever for folks. But then once they catch me of like at the tail end of it, where I'm just depleted of my extrovertedness, they're like, well, what's going on? Like, why aren't you more hoorah and stuff? I'm like,
I'm tired.
different cycles. I gotta recharge my own introverted battery now because it's the cycle of like the weaning parts of it. And it gets
Hmm.
tiring too for folks where they can't always be the same person 100% of the time and that consistently. And that's the same thing too for people with blood sugars. Like they want to have this perfect blood sugar that's always 95 and then everything is a miracle and everything's perfect for them. I'm like, check again in 2 hours. I can guarantee you it's probably not going to be a 95. It's probably going to be at another number. So it's
Yeah, but also, do you want to enjoy your life and eat ice cream and spend that time with your family? There's so much more to living than just having that one thing. And I think that's also been a huge lesson that I've been working on in therapy is process without a goal.
Yeah, exactly. It's a similar thing of being the total package, but then being sent to the wrong address. Are you going to focus on trying to say, oh, this world's against me. Someone made a mistake, or I made a mistake that I'm not where I should be at, or those sorts of things. So it's, what if that address that you were sent to, being the total package, is like something that you can learn from that experience so then you can relate to someone else down the line that they need to hear what you've been through in order to realize, oh, this is normal. This is to be expected. That the package is always having additions to it. Like the software is always
Mm,
being updated. So it's sometimes that bump in the road, that miss session that's going on over there, that's necessary for someone else down the road, most likely. Because now everyone can joke around on Zoom saying, oh, technical issues on Zoom. People wouldn't have known about it if we weren't transitioned to Zoom. So
yeah.
now everyone has more grace for whenever a technical issues is going on because everyone's been through that. And that's a struggle everyone needed to be. So it's like the being sent to the wrong address, but in the long stream of things, it's the right address because being lost is also part of the journey.
Mm. Way to add meta to my meta. That's
Yep,
crazy. I
exactly.
love it.
I play off of things like that. All right, Kate, if you were to share one piece of advice for a woman with gestational diabetes or has postpartum diabetes, what would that be?
It's not your fault. There's so many factors. Take the blame off of yourself and instead focus on what we can do in the moment. It's like acceptance is hard. Acceptance is the hardest thing, but validate yourself in that it sucks. And that's okay. You're allowed to cry for 30 minutes, 30 days if you wanted to, as long as the way you're cheering yourself on is that equal amount of time.
Hmm. Yes. Just keep going.
I don't
You
have to keep moving forward tattooed on my ankle for nothing.
Yep. All right. So another question that I want to ask is, what does the ideal world look like to you when your mental health advocacy efforts are made and that can be changed with that snap of the finger? Like, what would that look like?
Mm. I this one's hard because I have so many different lenses I can put on and so many different hats. My undergraduate degree was in healthcare ethics, and it's always interesting because what you think is right is not always, and then you like keep asking questions. You're like, oh, wait a minute. So it's hard to think that my idea is like the ultimate and right, but I would love for people to stop acknowledging things like ADHD, autism, anxiety disorders as problems, and instead starting to amplify people's strengths, start looking into better universal design of education, better universal design of communication, asking more, what do you need, instead of telling people what they should be doing. That goes for any and all disabilities, but in mental health in general, increasing access, increasing awareness, and if challenge the narrative by writing your own. And I'm so excited to see more people starting to talk more openly. I say a lot too, it's always so humbling when people like buy my stickers, and I have a stupid one that's like, all my systems are nervous systems. But when someone buys that, not only did they appreciate my art, but then they also decided that they wanted to put money, pay with their own money for it, so they could stick it on a place to send the message that they have anxiety. And I'm like, when I think about that too hard, my head spins because it's so cool. That's so if I can snap the fingers, people starting to be more okay and embracing their neurodiversity.
Hmm. And then people literally coming up to you at conferences. Oh my gosh, it's the
I was
DB.
like a little celebrity. It was so fun. It was so good for my ego.
Little ginormous celebrity.
Oh,
I'll get there one day.
I'll boost you. I'll boost you up. Don't worry. We rise by lifting others.
Appreciate it. We're each other's best cheerleaders.
Oh, exactly. Extroverts got to stay together.
Oh yeah, exactly. All right. So now moving on to the fun questions because we're getting close to the end of this, and I always love
Mhm.
asking this question.
Yeah.
What is your ideal full course meal for food? So it's like the whole shebang. So you got appetizer, you got hors d'oeuvres if you want hors d'oeuvres, main
Mm.
course, side dishes, beverage of choice if you indulge in beverages, whether that be chocolate milk or something stronger.
Ooh. So I always joke that life is made to be celebrated. And so instead of a funeral, I want a funeral. Obviously, for this, I would want to be like there for it. But I joke with like my best friend that like I'll never make her my maid of honor, but I will make her like my funeral coordinator. And so with that, I would want like a whole spread of like my favorite foods. So pancakes, buffalo wings. There's this place in St. Louis and Chicago called Soul Taco, and they do Korean Mexican fusion burritos.
Oh, sounds amazing.
So good. It would be like my last meal for sure. Mac and cheese, and then drink wise, probably Oreo milkshakes, mango margaritas, and then probably water. We need water.
Yep, exactly. It's gotta be like
Oh, and dessert, like cheesecake all the way. I love cheesecake.
solid options right there. All right. I'm not sure if you're a water connoisseur, but do you have a favorite water brand?
Tap water.
Tap water. Okay.
Tap
Okay.
water. Like it honestly, like I have an emotional support water bottle that I carry with me. Like I literally have an air tag on it. That's how emotionally attached I am to where if I lose it, I need to track it.
Yep.
And I am like filling this thing up like 6, 7 times. Like it's just it I don't have a preference of water as long as it is wet water.
Wet water?
Wet water.
Okay, that's fair. That's fair.
Didn't answer your question, but there you go. Got a good laugh.
Oh, you did answer it.
Oh, good.
Tap water.
Wet water. That's
Yep.
my favorite
What's
water.
what's water?
We have lost it, everybody. That
Oh.
has been getting close to the end.
Oh my goodness. All right. So the next question I want to ask is, what is your zombie apocalypse survival plan?
Okay, this is a controversial take, but so especially if we're thinking like in the realms of like Walking Dead and stuff, that's not like a society I would want to live in. So I would be okay either becoming a zombie or just no longer being a part of that process. I firmly believe that if your life is not enjoyable and living and you can go to Disney World, then it's not it's okay. Like that level of decimates is not, I just don't feel like I would want to survive in that and have to fight that sounds so exhausting. But if we can like quarantine all the zombies and like all of us like escape and live in paradise in Disney World and put a bubble around it, that could be cool.
Yeah, that's hilarious. one of the other past guests that I've had, she was like, I'm gonna go Team Zombie and test all the brains that are out there to see what
Ooh.
flavor that'd be. Like, would someone who's went to college would be different than a brain of someone else, or how would their genetics play a role of how that brain would taste? So it's nothing's gonna taste the same, but it might taste the same depending on the quality of stuff that's going on. So they're just like, it'd
So if
be,
I identify as neurospicy, having ADHD, do we think that my brain would be spicy?
I would think so.
Would it have a jalapeno, like a probably like some mango jalapeno like notes to it? All right, comment down
Yeah.
below like what you think my brain would taste like.
Yeah, exactly. And then think about it this way too. It's like, all right, what about those who've had a like traumatic brain injury too? Like, how does that work? Is that just like a smoothie blender thing going on too to
Like an
just
apple with like that one dent on the side that's just
yeah.
like begging to be thrown out.
But
That's why I
then it
said like I'm
tastes
three brain cells in a
phenomenal
trench
too,
coat. There's not much left.
Yeah. Or it's a pressure cooker of like just infusing the flavors together too.
It's
Wet water. Oh my gosh. All right, Kate, it has been an absolute pleasure chatting with you and having you on. I know the audience who's been listening to this, who's been watching this, who's been really feeling your message, they wanted to get in touch with you. So how can they find you?
Yeah, so the best way to contact me or follow what I'm doing is on Instagram, DPTs underscore with underscore anxiety. That's where I post all of my little memes and little motivational videos. So you can always DM on there. If you do want to work with me as a pelvic health PT, you'll find info over there because I am transitioning life and jobs soon. So I am moving to Rhode Island because my partner matched for emergency residency. Yay!
Oh, congratulations.
Thank you. So work and stuff is in limbo, but never feel free to reach out on that platform is the best to contact me at.
Kay's just another person, just like all of us.
Literally,
And
it's just me.
kind, caring, and she'll put you through the ringer at times to make sure that you grow towards a person who can be accepting and loving of others and being aware of that. So it's always a good time.
Patrick, thank you so much. This was so much fun. Thank you for following me along on this like crazy, not typical diabetic conversation journey, but it sure was fun.
Yeah, I relate everything to diabetes because
There we
everything
go.
in some way, shape, or form is going to affect someone with diabetes or someone they know who could eventually develop that and stuff. So it's always a
There
good
we go.
time. All
Bye,
right.
Patrick.
Have a good one. Thanks again, everyone, for tuning in. And of course, remember to do one small thing to improve your health. It could be taking in a extra minute when you're sleeping. It could be taking a sip of water, just like Kay did, or just sitting up and squeezing your butt for a few seconds to wake that butt up after sitting on it for so long. Whatever you need to do, and it's going to become an amazing habit in the future. So, wishing y'all's a lovely, happy life. Bye.